problem with your car, so you go to the mechanic for replacement parts. But what happens when it's your own body? This might be the answer. We're here on location in Waltham, Massachusetts, along the 128 Technology Belt with Histogenics. John Lieber, CFO, and welcome to the Language of Business.
Thanks for having me.
What are orthobiologics and regenerative medicine?
So regenerative medicine and orthobiologics are actually an umbrella term to describe a sector of the biotech industry in general. Regenerative medicine is the process of taking a patient's own cells or taking cells from another source and creating them, putting them into, manipulating them, doing things with them to allow them to serve as a personalized individual treatment for that individual.
John, can you give us a product demonstration, please?
Absolutely. So what you have here is a living piece of articular hyaline cartilage tissue. The way we make the tissue is we take a small biopsy from a non-weight-bearing portion of the patient's knee, about 200 to 400 milligrams of tissue, about the size of a Tic Tac or two. We take that back into our lab. We do a series of cell isolations and extractions, put the cells in a 3D collagen matrix, which looks a little bit like this. This is actually the matrix, or what we call the scaffold. We send that into 2D cell culture for about a week change. It goes into a bioreactor for another week, and then it sits in test tubes basically for another couple weeks after that. And then once that's done, you basically have a living piece of articular hyaline cartilage that's ready to be reimplanted into the patient by the surgeon. So where you would get a cartilage defect, it could first of all happen from repetitive wear and tear, or it can happen from an acute traumatic injury. And where you get it is on the ends of the bones that meet in the joints of the knee, and you can get a little divot there, and left untreated, that divot will get larger and larger because in adults, cartilage has no innate ability to repair itself. And so what we do is we basically fill that divot in with a living piece of tissue that integrates with the rest of the cartilage in the knee.
And what is the recuperation period as opposed to doing nothing or using some other tried and true surgical procedure?
So interesting. In our phase 3 clinical trial, we're comparing to the standard of care, which is called microfracture, which is a surgical procedure where they drill holes into the subchondral bone under the divot in the hopes of recruiting mesenchymal stem cells that will basically differentiate into articular hyaline cartilage. It's not a bad procedure, but up to 30% of the patients have a re-op within the first couple of years, and the results are very variable. And so what this is designed to do is compare to that. And oftentimes, for example, if you're a swimmer or a runner or a golfer, it may be up to a year before you're before you're back on your feet doing what you want to do. In the case of NeoCart, which is our product that's in development right now, we've got actually patients who are back to their normal activities as early as 5 or 6 months post the surgery. So you're really cutting back almost half the time of recovery.
Can this be used for other parts of the body moving forward?
Good question. So it can, and actually if you can repair cartilage in the knee, you can probably repair it in any other joint in the body. And we make our own scaffolds now, and so by doing that we can make a size that fits the knee, we make a size that fits the elbow, the shoulder, the hip, etc.
Do you tend to grow organically or by acquisition, such as in the case of Histogenics, Procon?
So interestingly, we merged or bought Procon back in 2011. There was some commonality in some of the investors for the companies. There was some synergies that we got by putting the two companies together. They had certain technologies and we had certain technologies. And so in that case, it made sense. I would say most of our growth will be organic going forward. Although once we get commercial, and if we get commercial, our objective would be basically to hopefully combine this product with other products that we could sell through the same commercial channels to the same physicians and patients.
From the CFO's perspective, what goes through your mind every day running the company?
So a few things. Number one, we got to make sure that we're developing products that are safe and effective for the patients, that we are developing products that will hopefully meet the FDA's approval guidelines, that the company is funded because we're a company that doesn't generate revenues right now, so we're constantly looking to line up our next round of funding. And to make sure that our operations are running efficiently and effectively. And of course, we're also public, so we have public filing requirements that we have with the SEC and other requirements that we have to meet the requirements of being a public company.
John, thank you.
You're very welcome.
John Lieber, the CFO of Histogenics here in Waltham, Massachusetts.